In addition to the shortage of rural physicians in some parts of the state, emergency medical services like ambulances and EMTs are also in short supply. Joining me now is our Lisa Hines.
That's right, Rob. Oklahoma's emergency medical services are in crisis mode. Since 2001, over 50 EMS services have closed their doors, leaving many Oklahoma residents without emergency care. In 2011, House Bill 1888 was signed into law, creating the Ambulance Service District Act. Its intent? To end the decline of emergency medical services here in Oklahoma. And while the law was put into place, funding for it was not, which is why lawmakers held an interim study to figure out how to keep Oklahoma's EMS systems viable. When a medical emergency happens, you naturally expect help to be a phone call away. But according to Rodney Johnson, director of the Medic Institute, our state ambulance services are at unsafe levels.
The fact of the matter is this business model of the way we have been delivering emergency medical care no longer works and is on the verge of collapse. I call it the #1 public health threat that no one's ever heard about.
And in a time when the legislature is looking at cutting taxes, Rodney fears that could have deadly consequences.
When I started this process with Medic Institute 5 years ago, the floor leader of the House of Representatives told me that sometimes in the state legislature, things have to totally collapse before we do anything about it. Well, in the EMS business, that costs lives. So the state legislature needs to decide how many lives is it willing to sacrifice before they're willing to do something about this deplorable problem.
It's a problem that legislator Seneca Scott feels needs to be addressed.
Well, it's important on a lot of different levels. I think that in part with just the tightening of resources we've seen statewide, nationwide, internationally, there's an ongoing effort to make the most bang for our buck. For now, also, in addition to the expenses, is also the weighty matter of public safety and getting people, the proper medical care needed.
Now, according to Rebecca Smith with the Oklahoma Ambulance Association, a special district may be one way to address the issue.
522 districts are ambulance service districts. They can either be by county or by city, or they can be by school districts, and they're funded in part through ad valorem taxes or property taxes.
But funding is still an issue.
We need them to realize that there's no one fix. Nothing is going to solve the problems that we have in EMS, but if we all work together, we can all have a piece of the different things that may help, and removing the cap or eliminating the cap of 3 mills, which has not changed since 1977, would be a small part of how we can help EMS services across Oklahoma shore up and maintain their ability to respond to the people who need them. There are many solutions, which we're so grateful that they're having the interim study, because this is a start to finding those solutions. It takes all of us working together.
The fact of the matter is, it takes a certain amount of money to run an ambulance service. It takes a certain amount of money to be able to have a well-educated workforce that is able to respond in today's medical environment. So while it is a local issue, there's no two ways about it. This is a problem that the state has to put some money into. I believe my best estimate is $40 million. Is what it would cost in today's money to be able to fix a lot of the problems that are associated with emergency medical care now. Where's that $40 million going to come from?
A good question, and one these EMS supporters believe legislators need to focus on. Now, one solution proposed at the interim study was for an EMS tax to be included on utility bills. The only problem is that while rural electric companies didn't seem to have a problem with that, the Public Service Company of Oklahoma, or PSO, says they don't collect taxes in lieu of their fees that customers haven't voted on.
Now, I can see where that would be greeted with enthusiasm by some folks because it spreads the taxing base out to people outside of just property owners and ad valorem taxes to anyone that pays utility bills. Now, before you go, answer me this. Is there any EMS system that is actually doing all right?
There are a few, and one in particular that really impressed me is in Craig and Delaware counties. It's called the Regional Emergency Medical Ambulance Service, and it was formed through the work of a public citizens community from Craig County and the towns of Veneta and Cleora. And with 3 funding sources, they're able to keep their ambulance service open 24/7 to the entire area. And they say being able to combine it, they can give this service at a lower cost than if they had the services separate.
Well, it certainly sounds like a good example of communities working together for everyone's economic benefit. Thank you so much, Elisa.
You're welcome, Rob.
Now, if you'd like to see how one young EMT is using both his faith and the latest technology to serve his small town, just head to our website and look for the Paramedic Preacher under this week's Value Added.